My name's Louise. I'm a consultant physiotherapist with an interest in stroke recovery and person-centred care. So I work full-time in the NHS in what is now one of the largest stroke services in the UK, and I have a split role, which is 50% research and 50% clinical service delivery. And my research focus has really evolved since I completed my PhD about 12 years ago. So I stepped into research because I was curious about some of the approaches that we use in stroke rehabilitation, and to an extent frustrated by lack of evidence-informed practice that I was seeing in my clinical work. And my PhD focused on models of motor recovery after stroke, so directly informed by my clinical role, and quite a physio sort of focused PhD topic, really. But through that process, and as I developed my research skills and my research network, I found myself increasingly interested in the behavioural aspects of stroke recovery, and as much about kind of workforce behaviours as about those of patients. And this opened up new areas of research for me that felt very relevant to my role as a clinical lead and a consultant therapist, particularly around behaviour change, implementation science, and person-centred care. So all of this has led me to clinically lead a very large multi-professional team of AHPs and nurses, and one that is truly evidence-informed and research active and patient-centred in the work that they do. And in addition to the research outputs from my studies, one of the broader impacts is achieving this research and improvement culture within the service and the organisation where I work, increasing research opportunities within our workforce, all things that we know directly impact patient safety and quality within NHS services.